Hello guys, welcome to my channel. My name is Maxwell Abwire and welcome to the Health Talk Kenya. In this channel we discuss about the different health issues in our lives. And it has been long since I posted a video in this channel because there was something which I was working on which consumed a lot of my time, but I thank God I've been able to do it and I have time to make videos. So today I'm going to talk about the several assessments which you need to perform to your baby. As a routine, it is a requirement that all babies born in the hospital be done a thorough head-to-toe assessment to detect the several abnormalities, deformities, and the problems that the babies might have. But in most cases you find that it is not the case, because in our settings you find that the ratio of medics and the patient is always low. So the medics, there are several specific things which medics are not able to detect, and most of the time you find that as a parent you are the one who stays with the baby a lot. You spend most of the time with the baby, so it is good for you to do an assessment of your baby so that to know that the baby is born normally, and to know if the baby has any abnormalities which can be corrected. And it is good to detect the abnormalities when the babies are young, so that they can prevent so that we prevent them from complicating, or so that they can be corrected. So welcome. Remember to subscribe, because it is only in this channel that you can find health-wise informative video. So welcome and enjoy the video. Welcome again. So before leaving the hospital and before performing the assessment of the baby, before leaving the hospital you must ensure that the baby is breastfeeding, the baby has passed stool, and the baby has passed urine. Most mothers only focus on breastfeeding and forget about the other parts. Sometimes you might find that the baby probably has not developed the anal opening or the urethral opening. So it is good to detect these abnormalities before you go home, because the baby will have to be performed surgery so that they can correct the abnormality. So before performing the other assessment which I'm going to talk about today, ensure the baby is breastfeeding, has passed urine, and the baby has passed stool. The first assessment you need to perform in your baby is assessment of the genitalia. First of all, in male you have to assess the testes and the penis. You place the baby on lying position, whereby you examine the testes. First of all, you have to know the presence of the scrotum, the coloration of the scrotum, and the skin pigmentation of the scrotum. The scrotum should have the rugae, the folding of the skin. We call it rugae. The absence of the skin folds means that the testes have not matured properly. Secondly, you have to palpate or touch and feel the presence of both testes, the right and the left testes. In newborns, before the babies are born, the testes are usually formed in the abdomen before they descend back to the scrotum. So sometimes you might find that the testes fail to descend to the scrotum. So by assessing the presence of the testes in the scrotum, you will know if the baby has abnormalities in the descent of the testes, which might affect him in future on issues about fertility. So you have to make sure your baby is okay, because if the testes are not descended, you have to take the baby to the hospital, whereby they will perform a surgery so that the testes will have to descend to the scrotum. And number two, you have to assess the penis, whereby you try to pull the foreskin to retract the foreskin. Sometimes you might find that there are boys, the babies whose foreskin cannot be retracted back, and this might cause your baby to develop UTI because there are some infections which some bacteria which can develop or exist inside that scrotum because it is not able to be pulled back, so that in times when you are washing the baby, you will not be able to clean it properly, so the bacteria might grow and develop behind that foreskin and cause your baby to have a UTI. So if the foreskin is not able to be retracted, the baby will have to be circumcised so that to make sure the baby does not develop UTI while they are still young. Also, while assessing the penis of the baby, you must note the position of the urethra. Either the urethra is supposed to be located centrally at the penis, so you must note if the urethra is present and the location of the urethra. Either if it is positioned up or down, you have to seek medical advice so that they can know if that can be corrected. On the assessment of the genitalia in the female, you have to note the presence of the labias and the urethra. Also, sometimes you might find that in some young babies who are girls, you might find that they might be having some secretions, some vaginal secretions in form of mucus and some spotting of blood. That is normal. We call it pseudo menstruation or false menstruation. That is normal, and it will resolve on its own just with the time. The second assessment you need to do is checking for tongue tie. Just open the baby's mouth and try to pull the tongue of the baby from the lower jaws. Sometimes you might find that in some children, the tongue, this one cannot be retracted from the lower jaws. So that is something we call the tongue tie, which will have to be corrected surgically. The third assessment you need to do to your baby is assessing for extra digits or extra fingers. You must note the presence and the number of the fingers. If the baby has extra digits, depending on your culture, you can take the baby to the hospital so that the extra digits can be removed. Or if you are at home, you can just take a thread, Uzi, just tie it tightly. They will fall off on their own. It is painful, but they will fall off on their own. Also, while assessing the number of fingers of your baby, you must also assess the creases, the palmar creases. Normally, in normal children, you will find that they have either 2 or 3 creases. When your baby has 1 creases, these lines in the hands, it is a sign that your baby might be having Down syndrome. The final assessment I'm going to talk about today is assessing your baby's foot or legs for club feet or board legs. Children have very small feet, and it is not always easy to know if the baby has abnormalities in their legs. So you must know that the bottom part of the foot, the plantar, we call the plantar part of the foot, should always be 90 degrees to the leg. So any slight, any abnormality in that, you need to seek medical advice. You must always also check for board legs. Board legs are legs which are, they look like someone who has rickets. So it is good when you detect the abnormalities of the bones when the babies are still young. You find that babies' bones are always fragile, and they can be easily corrected. Unlike when you wait until the babies are matured, now you start seeking on how to correct them. When they are still young, just go to the hospital, whereby you will be assigned orthopedics. You'll be taken to the orthopedics, whereby they will have to be corrected. All the clubbed feet and the both legs, also the deformities, the bone deformities of the hands can also be corrected. So it is good for you to do the assessment of the legs, so that to detect if these deformities early as possible. So those are just but a few of the assessments which you need to perform as a parent, be it the mother or the father. Those are the assessment which you need to do, so that to know the abnormalities your baby might be having. And the earlier the detection of the abnormalities, the better, because you will be able to do to correct the mistakes or the abnormalities as early as possible. So with that said and done, I've come to the end of my video. Please remember to subscribe, because it is only in this channel that I share health-wise informative videos. And subscribe for more, because I'm going to share more and more videos on health. With that said and done, bye bye. Rickets. So you have to check for the presence of the you have to check and assess. You flex the baby's foot, you flex and extend, and to know the angle which the baby's feet lie. So the feet, the bottom part of the